All right, so timely filing limits. We are here again where we're about to start a new calendar year preparation. The insurance companies are looking to update your contracts. They are looking to renegotiate fees with you. Lots of changes happening with their policies. They're reevaluating their internal structure and policies. So do expect that there will be some changes. The insurance companies are often looking to evaluate their timely filing limitations. We've already seen a movement of insurance carriers reducing their timely filing down. So where it was common that insurances had 365 days, a very generous amount of timely filing, we are now seeing that reduced down to 180 days and then down to 90 days. So very important to be paying attention to your contracts. So what can you do to help yourself with this particular predicament? So timely filing is reducing, yet might take you maybe down to 30 days, and maybe it's taking you 2 months or 60 days to get a claim out the door. What can you do to help improve the likelihood of your claim getting paid in time? So you should ask yourself 3 questions when you have that in mind. The very first question is, what is your data capture like? How effective and accurate is your data capture? First question. Second question is, how long is it taking you to close or reconcile your day? So after the provider of service has entered and finalized their SOAP notes or their daily, their documentation for the day, after the provider of service has finalized their documentation for the day, how long is it taking your team to go back through, reconcile the day, confirm the patient's charges moved into the software accurately? Number 3, what is your current first past claim rate? Do you even know what that is? So back to question number 1. How effective is your data capture? So when we talk about data capture, we're talking about patients' demographics, their insurance information, all of the information that we need as a provider's office to transmit a claim to an insurance carrier successfully. You're going to want to make sure that you have a very effective data capture process and that you are making sure that you're doing your best ability to have that be as efficient as possible, maybe utilizing tools like eligibility checking, tools that can be added onto your software to ensure that if there is a manual entry happening, you don't have any human errors that are occurring. So you have a software that can interface with an insurance carrier through automatic eligibility that can help alleviate some of those issues because the software is sending the data through the insurance carrier site. So number 2, how long is it taking you to close and reconcile your day? A lot of times we hear from providers that they are needing to have a lengthier time to close out their documentation for the day. Problem 1. Then once that happens, once they finally close that out, then they have someone in-house that needs to get caught up on reconciling, maybe cashing out a process of a cash control in-house, maybe making sure that all of the patients that were seen that day have visits that were properly closed out within the software. And then there might be an after visit coding review happening as well. So all of those things, especially in an environment where there might be surgeries, where there may be a lengthier amount of time for the provider might need an unusually lengthy amount of time to close out their encounters or bring those encounters back to their office, then we are maybe adding in like another week or 2 to the reconciliation. So we might be 3 weeks away from the date of service and we get the claim out the door and you've got a 30-day timely filing. So you've got 21 days there that you've lost in just getting the claim ready. You've got a 30-day timely filing, and then you have to worry about the accuracy of data capture, which was number 1. So very important that you think about the speed in which things are moving through your revenue cycle to ensure that you don't have to put more of a bottleneck or cause more of an issue that you might have problems down the line with. So issues that might start to push your claims into timely filing, starting to create habits around the most stringent of timely filing, those 30 days of timely filing. That's going to help you create proper habits that are going to help you have a more smooth revenue cycle. Number 3, what is your current first pass claim rate there? So first thing to think about is if you are not at 98% or higher, which means at least 98% of your claims are going through to the insurance carrier on the first time, then you have some work to do. You're going to look at the numbers 1 and 2 that we just talked about. Then you're going to make sure that you have a proper claim scrubber. That is one quick solution that can help improve what is happening that might be kicking your claim back out. So very easily, eligibility, that problem 1, making sure there's a closeout where the provider of service and someone in-house, maybe a coder, is reviewing your services. Number 2, and then layering on top of all of that, a claim scrubber, which might be looking at your CCI edits, might be looking at the coding, depending on the scrubber. It might also be looking at just basic elements where with Medicare, maybe you have a specific modifier that you're required to use, or a specific CPT code, or a HCPCS code in lieu of a CPT code with Medicare is very common. So things that might be unique to a carrier, many claim scrubbers can catch that. Those are things that might kick out in a payer's clearinghouse. So you want to make sure that your first pass claim rate is as high as possible. That will make sure or ensure that your claim is at least making it into the insurance company's clearinghouse and ideally directly into adjudication where the claim is going to get processed. All right, so that concludes our video. So work hard on decreasing your likelihood of issues with timely filing. Work on these 3 things that will help to ensure that you are timely filing limitation ready. So as these carriers start to really get tighter on their denial, on their policies related to timely filing, you will be bulletproof. If you found this video helpful, give it a thumbs up. And if you're new here, welcome. We post videos each and every week. So don't forget to subscribe and hit the little bell so you don't miss out on videos that will help strengthen your knowledge and the business side of healthcare. Until next time, my friends.